state your name and your profession, yes?
My name is Sarah Lopez, and I'm currently a registered nurse here in Maui.
My name is Gavin Manoa. I work as a licensed practical nurse right now in a community clinic, and I also have experience working in long-term care facility and acute care hospital setting.
My name's Carolyn Curry. I'm a registered nurse. I've been a nurse for 18 years.
My name's Whitney Jones. I'm a licensed practical nurse, and I've been a nurse for 2 years.
Where do you work?
I work at Kaiser Permanente in OB/GYN department.
I work at Thomas Memorial, which is a hospital, and I am considered floor staff. I work on a unit called 3 Pavilion, and it's a med-surg floor, basically.
I work at Thomas Memorial as well. I am part of the float pool, so I work between all 3 med-surg floors, and I also do travel nursing.
How long have you been a nurse or in the medical field?
I've been a nurse for 2 years now. I've been in some capacity of a medical or health field atmosphere for maybe 4 or 5 years now.
I graduated in 2002 with my associate's degree as a registered nurse. However, I worked prior to that at my medical group as a medical assistant and LPN since 1999.
Well, I've been in the medical field 18 years.
I've been in nursing in the medical field for 2 years.
What was the academic or training requirements for this job?
2 weeks of prerequisite courses required to apply to my associate's program, and I'm almost done completing my second year for my associate's program. So a total of 4 years.
I went to a 2-year program. They do it by a points-based system where I went. You had to get a 21 on your ACT, and that gave you so many points. You had like your prerequisite classes that also gave you points, which are classes that are not directly related to your nursing program, but classes that you have to take, like your chemistry and your algebra, your microbiology, your psychology, things like that, that get you ready to get started in your program.
My program was 1 year. It was a little longer because of COVID. They require that you take a TEAS exam, which is like a modified like ACT, SAT system to just make sure that you're ready to get in to the medical field and that you're knowledgeable enough that you'll pass your classes.
Why did you want to become a nurse?
You know, I grew up in Hana, and my mother has been manager of the front desk and receptionist back office at Hana Medical Center. So I grew up my whole life being around the medical field, going to my mom's workplace, being around nurses, and just being there and watching them. I loved it, and I'm like, I'm gonna go into a medical field after that.
For so many reasons. To make a difference, to impact lives. Early on as a child, my mom worked as a CNA, and I was witness to how she provided care and also helped out with caring for family members. And being a patient myself at a young age, I saw the value in the quality of care that could be given, and I wanted to be a part of it.
I wanted to become a nurse because I originally had started out as a nursing assistant. One of the nurses that was my boss told me to go to nursing school. Finally, I just went. It takes a lot of courage to jump in there, though.
I got into nursing. I originally had wanted to get into the medical field in some way, and I thought maybe I wanted to be a doctor, and then realizing 12 years of total in medical school was not for me. So my aunt was super sick when I was young, and I loved being a part of her care. Then I also realized how much the nurses did as opposed to the physicians. The doctors are only there seeing patients for 15, 20 minutes in nursing, and the nurses are there for 12 hours. They're the ones that take care of your family members when you can't be there, and they hold them and comfort them and are super involved in their care. So that was important to me.
What are your hours and how many days do you work per week?
I work 12-hour shifts. I usually work 3 12-hour shifts a week, which I make out my own schedule, so that differs depending on what I need to work and what they need me to work.
I also work 12-hour shifts. I try to lay my schedule out for 3 days on, 1 off, 3 days on, and then I have a week off, so I don't have to take vacation. I am also per diem here at Thomas, so I work a commitment of 32 hours for 6 weeks, so I just make that whenever I want.
Usually full-time, 40 if not a little bit more per week, just depending on where I'm working at the time.
Tell me about a typical day on the job.
Typical day on the job. Very busy. You barely get time to breathe, have a drink, eat lunch, or use the bathroom. It can be stressful, but at the end of it all, it is very rewarding.
Well, a typical day for me just depends on what staffing we have. If we have enough staffing, then I'm usually the charge nurse, which means that for like all the LPNs like Whitney here, there's some things that they're unable to do, like push medication, certain medications, especially pain medications and things like that. For example, tonight, one of her patients had never had the antibodies remdesivir given before, so I had to give those and stay in the room with the patient. But normally if I'm in charge, that's what I do, is cover the LPNs, and then if there's admissions, I go do the initial assessments on them, because those have to be done by an RN. At other times, I'm just a floor nurse. I come in, I get my assignment, I assess my patients, I pass meds, keep them alive all night.
I'm alive till 7:05. A typical night for me is I come in and I get my patient assignment. And if there's enough staff, you may only have 4 patients and get an admission, but typically with how it's been, you have 6 patients. So you go around, you make sure everyone's doing okay and they're breathing, introduce yourself, you go back, you see what medications they need to have, plan out your night based on that. So you kind of only have to really do 1 med pass, hopefully, do your assessments, pass ice water. You're helping the CNAs with what they need, because there's far fewer of them. Calling doctors, putting in orders, getting labs ordered, scans, whatever they need for the night, and then after 12 hours, you're finally done.
It's 8 to 5, normally Monday through Friday, but however, since pandemic has hit, I have been working some days 6 days a week, on Saturdays, weekends, nights till 8 p.m. But a typical day, clock in. Most of the time I do advice. Sometimes I do triage on the floor. And then also a typical day can also include doing ultrasounds and non-stress tests on our high-risk prenatal patients.
What would you say are the strengths and weaknesses of your job?
Non-compliant patients that don't comply, no matter how much times you talk to them, you help them, you get them involved with their care. The weakness is, trying to help them get to a better lifestyle and a better place in their life as medical-wise. They just don't want to do what you say, so it's a weakness because you feel like you didn't accomplish a lot by not helping them. However, on the positive side, there's more people that you help out and take care of than the people that don't want to, take care of themselves. But overall, it's more strengths than weakness.
What would you say the strengths are?
Satisfaction of going home that you knew that you helped a family, or especially now with COVID, trying to, help them by not coming to the clinic, whatever resources that you can use outside, getting, deliveries to their homes, or just more overall satisfaction.
It teaches you to work on your own, to think on your own. Another one of the big ones, for me anyway, is the schedule. Like, you work 3 days, and then you have 4 off, or have it scheduled like I do, and then you get a week off. It teaches you to be resilient, to think on your feet, to have a backbone, to be vocal and stand up for what you believe in and what you think the patient needs. I think that's definitely one of the strengths. You become almost a better version of yourself.
I'm with her. I mean, you have a lot of independence on your scheduling. You have to do a lot of critical thinking. You can't just go by what others are telling you to do. You have to grasp from your knowledge from school and from, your day-to-day workings with people, and everybody's different, so what worked last week for one person may not work this week for this person, so you're constantly having to use critical thinking skills.
No day is like the previous. Every day is different.
You never have the same day. I mean, every day is different.
It's definitely not boring. Some of the weaknesses, I think you take a lot of it home. What you do, and especially with COVID, there's a lot of loss and a lot of really sick people.
A lot of sadness.
A lot of it. And a lot of the times the families aren't there, so you're their comfort system. And when you take that home, we have HIPAA, you can't talk to anyone else about it. So you kind of internalize and deal with that alone. And the losses, they stick with you.
Now, since we have had COVID, our hospital, we do have it set up where we can FaceTime with the families. In the beginning with COVID, we weren't allowed any visitors. Now they are allowed visitors, only from 12 to 6, and they can only have one visitor per day now. So that's lightened up our load a little bit as far as communication with the family and stuff, because that was what was really hard.
In some of the work I've done, a lot of people just aren't able to take care of themselves. And so it's comforting to know that you're able to be that person for them. Weakness is not having enough time sometimes to give patients what they need, and not having enough resources to accommodate all those needs.
What are certain skills someone should have for this job?
Patience, good work ethic, and having an open mind. You encounter so much diversity in this field of work, so that I think would be one of the most important things.
You got to be able to critical think. For sure. There's a lot of nurses in nursing that didn't do that, but that's what makes our job a little bit harder. Be a good worker. You have to show up and be accountable for what happens during your shift.
You can't be afraid of hard work. You have to have a backbone and be able to stand up when you don't think something is right or wrong. So you have to not be afraid to voice a different opinion than someone else, because not everyone is always right. You have to also be able to know when you're wrong. I feel like you have to really be able to put yourself in someone else's shoes. Normally they come here, they're sick, this is one of the worst times of their life. So you have to remember that when you're treating them, and treat them with kindness. And sometimes it is very, very hard.
Because not only are you dealing with the patients, but you also have to deal with the patient's family. And, like she said, the patient, this sometimes is the worst time of their life. Some people are dying. Some people are very sick. The families are worried. You just try to reassure them, with what's going on, give them updates as much as possible. We have patients that are confused or have dementia. So those patients are very hard to take care of. And now we are seeing a lot more with mental health issues. Around here, a lot of the population that we serve are either homeless or they have a drug problem. You also have to deal with those issues along with their health issues. So that makes it very difficult sometimes.
Yeah, you have to be really adaptive to your approach, the techniques you use to each patient. The elderly may need some comforting, or you may need to pretend that you're their granddaughter when they're really confused. But then the needs of someone with mental health issues and the way you approach them and treat them is different than your person that is COVID positive and needing BiPAP, or the person that just had surgery. Every person is different, so you have to be adaptive to their needs and your approach to treating them.
I think as you go along and you do your clinicals, then you'll figure out which area works best for you. You know, the ER, then, you know, it's more, you know, critical skills, it's more, you know, those kind of things versus if you wanted med surg or geriatric. But I think as you go along and you realize, you know, you find out which departments you want to work or units, then it varies. It changes as different departments that you want.
How did COVID-19 affect your job?
The pandemic has really limited health professionals in how they can provide for the community, and it's made it even difficult for us to not just keep ourselves safe and our patients safe, but our families at home.
So it was really slow. However, we every day still have to show up to work because everybody needs health care, especially in OB where, you know, the pregnant women need us. I also went to California last year in 2020 for a month because they were so in high need of nurses that 18 of us Kaiser nurses actually flew up to California to work a whole month. So I did leave my family for a whole month to help out working in the hospitals. So that did affect, you know, my family. But again, also same thing. You do it because that's why you became a nurse, and you know, coming home every day knowing that you did something good helps you get the next day going.
So we maintained usually 6 patients apiece, and we had to wear a lot of isolation in all of the rooms. So if you forget something, you just pray that someone's out in the hall that you can yell and say, hey, bring me this, and that way you don't have to ungarb and garb back up so much.
I pretty much started at like the very, very beginning of COVID. So it has changed. Obviously, we talked about the visitors and having family in here, so that, you know, put people and the patients on edge and the families on edge. And it's definitely, at first, when COVID was, you know, first emerging and coming out, everyone was terrified. So there was plastic wrapped everywhere. You were thinking that you're probably going to end up wearing like spacesuits. That did not happen. We ran out of PPE at points. We were very low. We were reusing masks to the point that they were breaking. I've never experienced shortages of IV flushes in my life, but we had that at one point. We had shortages of a lot of things. COVID made things more difficult by, I think, putting a lot of stress like on patient, staff, and family members. I know that I was terrified I was going to end up taking it home to the people that I care about.
And nobody really knew anything about it. So we were just like, this week we're going to do it this way, and the next week we're going to do it this way. It was constantly changing, and we were constantly adapting. Since we've had the vaccines, our COVID levels have really dropped, except for the people who have decided not to get vaccinated. We still have quite a few of those. Our floor holds 32 patients, and I think right now we're at 16 COVID patients up here with us.
How did your job and work environment adapt to COVID-19?
When the pandemic started, I was working in a full long-term care facility, and they were amazing in staying ahead of things. Because of the population of residents there, and how high risk they are to COVID-19, they shut down everything. So they really limited outside visitors in order to maintain the facility not having any positive COVID-19 patients, residents.
A lot of virtual appointments. So we set up a lot of our computers now all have cameras. So we have to learn the new programs of virtual where we could call you at home, and you could try as much as we could.
Did you make any mistakes early on in your career?
You always do. And especially the nurses who never ask any questions, those are the scariest nurses, because they're gonna make a lot of mistakes. Because even when you think that you are doing everything, you still have to realize you're dealing with people's lives. And I know whenever I first started, I gave dose of insulin than what was required. It scared me to death. The patient had no problems with it, but, I had to go in like every 4 hours and check their blood sugar just to make sure that it was okay. I had to call the physician and tell them what I had done, which doesn't make you look very smart. But like I said, everybody makes mistakes.
Everyone in their career makes mistakes, and it's a learning experience. I know I gave a whole dose of medication of a pill when I should have given a half, and my stomach dropped. And when I really thought I was going, it was something like a cholesterol pill, not anything that would have, but I was terrified. And I went and told my preceptor what happened. And she's like, no, it's just okay, let's let the doctor. And I was terrified that I was going to harm the patient, or I was going to end up in trouble. And you're not going to get in trouble. It's a learning experience. That's why they have the preceptorship, where you're under a nurse and you're learning and you're able to be monitored. And if you make mistakes, they're there to kind of guide you and help you. But I think every day you're working with something new. Like, I didn't know dialysis really before another nurse had taught me. So trying to hook up the system, I did that wrong. The bag was unclamped. We'll never do that again because it was all over the floor.
Yeah, once you make a big mistake like that and you got to clean up a mess, you learn real quick.
Yeah, but it's definitely, I think, a constant learning curve, and you're going to make mistakes. It's not just going to be a one-off sort of thing. And
she's only been a nurse 2 years, and that's why she hasn't seen. I've been a nurse for 18 years, and there's things that I learn every day that I never knew or didn't know, or
probably going to make mistakes in the future, and I'm just going to use that to learn from it, because I'm not perfect, and this is not a perfect world as much as they teach you in school. So you just really have to try to do your best and learn from the mistakes you made and try not to repeat them again.
I think the only thing that I wish I really did follow my dream of doing a mistake that I didn't was I really wanted to go into travel nursing. I think that was one of the reasons why I signed up to work in California, because it was a missed opportunity that I did have earlier after I graduated. So and I loved it. When I went to California, I loved being in a different hospital, different place. On my days off, we went out to different areas in California. So I think that would be my only mistake that I didn't make, was at least trying to be a travel nurse. But then I had my family, so I didn't go.
I'm going to go with one that we discussed earlier. I think right now in my current practice, I don't think nothing really comes to mind, but I started this career path a lot later in life than most people, and that has probably been my biggest regret. I love what I do, and I wish that I had the opportunity to start this career path earlier than I did.